So here we have an aneroid sphygmomanometer, and right here you have the bulb, which you squeeze to compress the bladder. You have the valve, which tightens and releases the air. Then you have the gauge, which tells you the numbers that are on there. And then the bladder is actually in here where it pumps up onto your arm.
Here we have a stethoscope. We have the earpiece, the neck, and the diaphragm. To correctly put the earpiece in your ears, we have to have these earpieces facing forward. In order to take an individual's blood pressure, you have to get the right cuff size. And in order to do that, you have to measure the circumference of the biceps. Overcuffing reduces oscillatory blood pressure movements, and it is when the cuff is too big. Undercuffing gives you a higher reading, and it is when the cuff is too small. The importance of knowing someone's blood pressure can diagnose a person for the risk of cardiovascular disease and is also known as a silent killer. Overcuffing and undercuffing can throw off results.
So when you have the client come in to get their blood pressure, you want to have them sit for 5 minutes. You don't want to have their legs crossed, and you want to have them with their arms at about 45-degree angle rested.
To correctly place the cuff on a patient, you want the artery mark to go over the brachial artery, and then you want the cuff to be secure on the arm, and place the stethoscope right under the cuff on the brachial artery.
So the units for blood pressure is millimeters per mercury, and you want to pump with the bulb up 20 to 30 above the normal millimeters per mercury, and then you want to release it with the valve 2 to 3 millimeters per mercury per second. And the first sound that you hear will be your systolic, and that is when the turbulent blood flow is rushing back through the veins. And the last thud you hear is the diastolic blood pressure, and that is low enough to where you cannot hear the turbulent blood flow anymore, and turbulent blood flow is the corticough sound.
Systolic blood pressure is the amount of pressure in the arteries when it contracts. Diastolic blood pressure is the amount of pressure in the arteries when the heart relaxes. White coat hypertension is when blood pressure is higher at the clinic and normal at home. Mass hypertension is when blood pressure is normal at the clinic and higher at home. Hypotension is lower than normal blood pressure, being 120/80.